you need the funds, really,
Definitely.
to resolve most of these issues.
Yes.
Now, leaving it in the hands of the federal government or the government, be it on state level, it's a different matter entirely. Talk us through how the government can begin to work with foundations just like yours and other NGOs, of course, to pull this through.
Okay. I mean, I was giving an example. I was at a function yesterday and it talked about the private sector and health issues. But it was working also with the federal government as well. So there was a three-pronged approach. So you have the federal government, the private sector, and the social sector all working together and bringing funds together to solve the problem. But not only funds in terms of money, I'm talking about resources in terms of human resources as well. And of course, I mean, you come into a country like Nigeria or you come to a state like Lagos, if they don't understand the state, then people get into trouble trying to solve the problem. We'd even do that. If you go to a community, you have to understand the community. You have to know who also is in charge of that community and get them involved in what you're doing. So those things are necessary. So that's the way we have to do it. It's not only about just pushing money into the different sectors, but also understanding what the issues are first and working together to accomplish those goals.
Now, taking a look at, taking a look at a country like Nigeria today, in terms of social ills and social problems you think that need, to be addressed, which of them tops the list for you?
Gosh, I mean, that's like just giving me. I mean, the thing about it is that if you say health, then you go into education, and they're all connected. And sometimes we also, when we go into the communities at work, and we always, we get a bit overwhelmed by the issues because you go there trying to deal with one particular issue, and then you see 12 of them waiting for you. So I always say, look for partners. Do not work on your own, and that's why we're partnering with the 25 organizations we work with. Do not work on your own. So even if that's not your focus, you can find someone that you can bring into the problem that you're dealing and the challenges that the communities face and see how best that we can all work together to do that. I mean, I would still say health. I mean, health is so paramount and it's something that we are really, really pushing a lot of our funding into at this particular time.
It's actually interesting you should mention health. I mean, just last week, one of the international media's, news stations made the rounds on the story on, drug abuse, pharmaceutical drug abuse in the country. And many Nigerians kept, saying, it's not just about banning the product, it's about finding out why we have so many youths addicted to that particular drug today. How do we begin to address this? If not, I mean, there are those who fear that in the near future, we might just be walking side by side with junkies on the road.
I mean, a lot of these things have epidemics, and we have to just begin to see, it's like even a business. You have to know what the foundational problems are first. Even when you're building and trying to solve the problem, you have to know what the foundation is. Because if you begin to solve without understanding it, when you get to the third story, it's going to crash. So it's the same thing. We say we need to know what the issues are first. The banning is just a first rate. Let's just do something. That might not be wrong either, but we need to find the problems and then begin to find the solutions. And also we always want to look for short-term solutions to issues. These things require a lot of time. This problem has been going on for so many years. I mean, if you talk to people, this is 20 years, 30 years. So it's not something that you can just throw something into it and just, it's something you have to go back, step back, ask questions, begin to relate with the people that are dealing with these issues, and then ask the pharmaceutical industries as well, what can we do better? Everything has to have different approaches. It's not a one-size-fits-all approach to solving problems.
To you, you're really very keen on finding out what the real problem is, getting down to the foundation. Talk us through, what plans you have in store for 2018 and how ACT Foundation is actually, planning to get to the root of the matter in order to address it and also even prefer solutions in the first place.
I mean, when I mentioned the four pillars that we work with, I mean, when we want to work with any organization, we ask questions. We don't just give funding just because people are looking for money. What communities are you working with? Are these even the issues that the communities are dealing with? Because Lagos is completely different from Edo State. It's completely different from Kaduna. All the problems, you might say, is the same health issues, but the way to solve the health issues is all completely different. So you find out that we have some people that are working in all those states, but we're asking them what is the solution to that particular community. And then we go and ask questions. So we're not just solving problems based on what we think is going on, but we're asking and talking to the community leaders as well and asking the people, because how do you want to monitor it? How do you want to measure what you've done if you don't even know what you're trying to solve in the first place? Okay. And that's the way we work with all the different organizations we're dealing with.
So clearly, it's not just about setting up a foundation and having laudable ideas on how to affect people's lives. I mean, you must do your homework.
You must do your homework. Passion is great, but it's a business. And if you want to be at the end of the day, in another 5 years, look back and say, we've been able to change the way malaria issues have been dealt with in Nigeria, you have to go backwards and start beginning to work forward to be able to accomplish that.
If you're sitting face to face with an official from the federal government today, and you're asked to prefer solutions as to address most of Nigeria's social ills, what would you say? Don't
throw money at it, first of all. I mean, sometimes we get all this funding from outside of the country and we just we need to spend it. We need to always get people on the table and all of us come up with solutions to those problems. Some of these things have been dealt with by a lot of non-profits that are working in the different communities over the years, and they've been doing good work. So we don't have to create new organizations. How do we help them to scale up? How do we help them to measure? How do we help them to monitor these programs and to give us results that's sustainable in the long term? That's what I'll ask for.
Now, is this doable, really? I mean, there's so many things you've just mentioned to begin with. I mean, it's really difficult to actually tackle one to start with, but is it really surmountable?
It's doable. It is. I mean, when you look at how Bill and Melinda Gates have worked across Nigeria in the last few years dealing with a particular issue, you see that it just takes time. It takes time, it takes a lot of work and a lot of focus. Well, the only problem we have is that so many other things come and then we get distracted. We need to be very focused and be very diligent about what we do. It is very, very possible.